Hi everyone, we're just going to let lots of you join us here on the broadcast today. Welcome. We'll wait for the numbers to go up before we start the webinar properly. It's great to see so many of you joining us. Welcome everyone that's just joined us on the webinar. It's great to see you joining in your hundreds. Welcome. We'll be getting going in a minute or two when some more of you have joined. Okay, hello everyone. Welcome. I think we'll start with the housekeeping now because there are still some people joining, but we can get going with the welcomes. As many of you know, I'm Anna from the TUC. It's great to see so many of you joining us here on World Mental Health Day. And as you know, today's webinar is about mental health, specifically mental health in the workplace, and what we can do to make improvements. We'll be getting onto that in a minute. Just some of our housekeeping. We are recording today as we usually do. If you miss any of the webinar or you want to rewatch it, we'll be sending you all a recording later today. Anyone who's registered will receive a link to the recording, along with any resources that we mention during the webinar. We are, of course, we do of course have captions available. You can click the More button at the bottom of the screen to have captions running along the bottom of the screen, which is our traditional way of showing the captions. There is also an option to open the captions in a new window. My colleague Tanya will be putting some instructions about how you do that in the chat panel in a few seconds. So do look at that if you want to open the captions in a new screen. We are offering a digital credential for today's webinar. So if you join us live, we will send that out again to all of you tomorrow. That will come tomorrow morning. And do please post any questions that you might have for our guests in the Q&A panel, which is again at the bottom of the screen under the videos, and it looks like two speech bubbles with Q&A. And we'll try to get to as many of those questions as we can after the presentations. So as I said, today's webinar is about mental health in the workplace. And before we get going, I just want to set the scene a little bit. As I said, it is World Mental Health Day, and mental health can be seen as a disability. The TUC always uses and signs up to the social model of disability. So that means that we advocate for barriers to be removed, barriers that people might face will be removed, rather than the individual or the worker needing to change to get around that barrier. TUC also uses language of disabled people organisations, so we refer to this group as disabled people. We will be posting links to some resources if you want to read more about this, especially about the social model of disability. Okay, I've talked enough. We've got three amazing guests with us today. We've got Jamie from the CWU, Stephanie from USDAW, and Geoff from the POA. And we are going to hear from each of them in turn about what they've done in their workplace. So I think we'll start with you, Stephanie. First off, can you tell me a bit about your workplace and what the issues were that led to you taking action?
Yeah, of course. Thank you guys. Welcome. So I work in a call centre. I work for Tesco call centre. So we deal with customers day in and day out. So what we've done recently is quite a lot of our customers' well-being and mental health has been affected due to abusive calls. So although we've got USDAW who have a great Freedom from Fear campaign that we run every year, helping our shop workers. Who are abused in the workplace. So we thought, let's bring it into the centre and let's help our colleagues who are answering calls. Let's help them if they're being abused. So that's where the mental health started with a lot of our colleagues who were being abused on calls by customers.
That's really interesting. So that then led you as a union rep to do something about it.
Yeah.
So can you tell us about what you did, please?
So I first of all reached out to my mental health team to see. We've got mental health wellbeings within our workplace as well to see what we could put in place. I reached out with my area organizer, and I also spoke to my two my health and safety reps, and we took it to our business risk team. And then what we've now done is we have now set up a platform to stop abusive calls coming into the call centre. So there's different stages of abusive calls that we get in the call centre. So us as a team, we've managed it, put management in place to say, actually, you can't call us, you can't abuse us anymore. And if you continue to do that, there is fines, there is jail sentences, there's lots and lots of different things that could happen to you if you call and abuse a shop worker over the phone.
Thanks for that. So what were some of the sort of specific steps that you took to present this case to your employer once you knew this was happening? How did you get the wheels in motion, so to speak?
So what we done was we reached out to quite a lot of our colleagues and members and asked what was happening, how they were feeling when they were coming off the calls. We helped them out with some of our It's Good to Talk brochures that we've got within USDAW. So we gave them and we told them that we're here to support them. We're a union. We feel they feel safe to give us any information that they need to give us. Then we took it in motion. We went to worked in partnership with Tesco to make them aware that actually members of our staff, colleagues are feeling like their mental health's really been affected. Then we took it to our business risk team, who then looked at the support that they could do to help our colleagues. And then from there, it just got even bigger. It went to quite a lot of different centres to help with us shop workers and colleague staff who get abused over the phone every day.
So have you noticed any impact of this campaign and the actions that you took on your members?
I've noticed lots and lots of impact, yes. Quite a lot of our members now have been coming to us and asking us for the bite-sized course. So we've been giving out all that kind of stuff to help them with that. Today we've done a big massive campaign within the call centre as well. We've been giving out lots of leaflets and stuff like that to help them with this. We've also got a wellbeing team within the call centre too. A few of them are reps as well, so they deal with a lot of the impact that we do receive off the back of this. It's not just colleagues, sometimes it's customers as well that we need to support.
And have there been any sort of other impacts as a result of this, like maybe you know, fewer colleagues needing time off or improvement in their general well-being because they've got a reduction in this, like the abusive incidents that led to this action in the first place?
So yeah, it has led to colleagues going off. It's also led to colleagues not feeling safe within the workplace. It's also led to colleagues feeling that they can't do their job anymore because they're being abused. So yeah, it did do quite a big strike in colleagues saying, I can't come to work anymore. I just can't do it anymore.
That's great to set the scene, Stephanie, about the work you've done at, like you said, the Tesco call centre. I've got one more question that I'm actually going to save until we've heard from Jamie and Geoff, because it's about
Okay.
general campaigning on mental health. And I think it would be interesting if we come to that all together
Yeah.
to hear about. So next up, we've got Jamie from the CWU. So first off, same first question, please, Jamie. What was the issue that started all this for you to take some action?
For myself, I think it was personally back in 2016. I was a relatively new mental health first aider, and I was supporting two colleagues with complex OCD, obsessive compulsive disorder, and there was just an apparent lack of knowledge or lack of commitment to enable support for them and their OCD, and it was being treated as a bit of a quirk in the workplace, rather than a disability, which it is, and It was even being joked about, and I realised that those people needed support, and we need to educate and challenge ourselves as a union, and also we need to challenge the employer as well to firstly recognise disability, mental health disability, and respond to mental health disability. That's probably still a challenge now, and also the big key one for us was the pandemic, when we need to support people. The pandemic was a huge stressor for so many reasons. I think in our union, key worker status was tagged to so many CW members. And when we were first sort of, trying to transit through the pandemic, it was probably seen as a badge of honour to be a key worker, but very quickly it became a badge of risk. And so we had smaller numbers of mental health first aiders back then. And, well, I'll tell you now, they were unsung heroes, as were many of our reps. The pandemic was something I think the country and trade unions were just not prepared for. And I think after the pandemic, we had to react again to it.
Yeah, thanks for that, Jamie. I think there's lots of evidence as part of the COVID inquiry that the country wasn't ready for the pandemic in lots of areas. So I think that's a really important point you've made there. Okay, so you've mentioned a lot of the issues that led you to take some action. So what did CWU and you and your team of reps do to make some changes? Oh, are you still there, Jamie? I think Jamie has maybe got a connection issue. Can everyone else still hear me? Yeah, okay.
You're fine.
Great stuff. I think Jamie has maybe got a little internet wobble. So we'll bear with him. He's definitely, because he's gone. Right. Sorry about the change of order. Geoff, we will go on to you, and hopefully we can get Jamie to come back to hear a bit more about the work he's been doing. So Geoff is from the POA, and he's got some really interesting examples of things he's been doing to improve mental health in the workplace. But first off, Geoff, same question. Can you tell us what led you to make changes in this area, please? Oh, can't hear you, Geoff. Nope. Okay. Right. Jamie's come back, and Geoff, I think we've got some issues with your audio. Just try once more talking to me. No. Okay. Right, I'm gonna have to think on my feet here. Are you there, Jamie? Should we go back to you? I think it's frozen again. Right. Let me rethink. So I think while we've got issues with, can you still hear me, Stephanie?
I could still hear you, yep.
Okay, just thought I'd check. Right, while we're waiting for the internet issues with Jamie and Geoff to be resolved, because there's obviously different things going on here, I'll come back to your campaign.
Yep.
What other question I was going to put to you was about what key takeaways have you got for someone who wants to have a workplace campaign about mental health? What are your top tips?
Top tips, I would always say make sure you've got enough resources. Make sure when you have got resources, if you've got a campaign table, make sure that when you have got something on your campaign table that you could maybe leave them elsewhere. Not everybody feels safe or strong enough to come to your table to ask for a leaflet. So we always have to be mindful that people might want to take these discreetly. They might just maybe think, oh, I'll come back for that later, and the stall might be gone. So we just have to be mindful for that as well. Also, be mindful of where you hold your campaign as well, because I know we in the call centre we tend to change it because some people don't like to come in. They feel like coming to work's a safe place, and sometimes coming into to see a big campaign about mental health and stuff like that could sometimes just make them go back and just want to go back home. So I would always say be mindful of them things, but I would say that USDAW's been running this campaign from 2022. year 2022, and it's been a very, very successful campaign. It's one of our best campaigns that we've ever held. Um, and I would just like to say that make sure you know your stuff, make sure you've got enough support. And also, what we do in our centre as well is we've got a lot of stuff at the back of our leaflets and stuff like that, but look for local help. There's local communities out there that help you as well. Just always go that extra mile for your members, and that's what we do within our centre. Just go that extra miles by saying, actually, you know, that if you could link in with anybody else, here's someone else you could link into. We've got little help groups that help up here, so it's nice just to make them aware that actually there is other people closer to home that can help also.
Thanks, Stephanie. And I think so, some really good tips there about, you know, you're not on your own doing this. Link in with other groups. There's no rule that says you have to do this as, you know, as a single organization. So I think that's really great. Okay, welcome back, Jamie and Geoff. Great stuff. Shall we go back to you, Jamie, for now? I'm worried that the camera's frozen again. Are you there, Jamie? Maybe not. It's okay. I'll come back to you in a minute, Jamie. It might be that you need to switch your camera off when you speak, because I'm worried the bandwidth isn't able to cope with both the sound and the audio. Geoff,
Can you hear me?
Give you a try again?
Can you hear me?
I can hear you, Jamie. Yeah. Okay. I'm not sure if we've still got the connection with. Oh, Geoff, are you there? Can we try you? Sorry, it's just a little bit.
Hi, Anna, can you hear me?
Brilliant. Very
Yeah.
relieved. Okay, so welcome. Geoff is a POA rep. So I'll hopefully now we'll be able to hear about what happened in your organisation, the prison service. What was the situation that led you to take action?
Anna, can you hear me? Yeah.
All good. Yeah.
Cool. Yeah, thank you. As you said, Geoff Willetts, POA, National Executive Committee for the Prison Officers Association. As you can understand, working in prisons is quite a daunting place to work anyway. One of the most violent and horrific places, obviously, within the Western country. Self-harm, lots of violence, self-harm, suicides. So you can understand quite a lot of our members participating on a daily basis. So there is quite a struggle there as well for our members to get the adequate support they require. HMPPS don't seem to want to come forward and do that. So obviously we try and do whatever we can do through using the trade unions and also the TUC in training some of our safety reps, some of our reps. We have a health and safety consultative committee that's obviously mental health comes under that umbrella, and we use that also on a national whitley. But as you can understand, we've got members that suffer from PTSD, PTED, and many forms of mental health concerns and problems.
Thanks for that background info there. As I think, you know, we can all appreciate, it's a prison is quite a very unusual workplace, and it's understandable that mental health issues can result from that. So what action did you, what did you do as a POA rep or within the POA to make a change in this area?
Obviously, and education is a big thing as well. Education and support for individuals. And I'm sure all my colleagues here would say exactly the same thing. It's about having that training yourself as well, and being able to signpost individuals and knowing the signs where they require, obviously, help. But
the education so that people can recognise perhaps you're saying perhaps recognise signs in their colleagues of what they're going through is obviously very important. But did you, as the POA, did you approach an employer at all? Did you make any changes to workplace policies or anything more broadly in a new workplace agreement?
I think we're constantly doing that anyway, locally and nationally as well, to obviously get the best for your members and also people that are suffering with mental health conditions. I think the biggest concern and biggest problem is people actually accepting that they might have a problem and might want that help. And there's a lot of obviously members out there that choose to either deny that or not particularly want the help. It's also sometimes used by the employer as well as a way of medically retiring or medical inefficiency payments to get rid of our members when they have conditions. Instead of supporting them in the workplace, it's more used as a tool to speed the process of getting rid of them.
And that's quite shocking to hear, isn't it? That it has not been, employers haven't reacted in a supportive, helpful way, and instead have turned this information on its head. Okay, so the work that you did to campaign and take action on mental health within the prison service, what impact has there been in prisons for prison officers? What have you noticed?
I think, especially at the moment, we've noticed a high volume of suicides with prison officers, with obviously, and also with that goes mental health concerns and struggles, which can also lead to things like alcohol abuse, drug abuse, and obviously self-harm. So it has an adverse effect on our members, and all our members really require support. I'm not saying all their members go down that avenue, but there is a high amount of suicides within prison officers, and you can only relate that to the daily pressures working within an establishment within inside a prison and seeing the most violent individuals that are locked away in a custodial environment, and also the self-harm's massive, especially within the female estate.
Thanks for that, Geoff. And it is really heartening to hear that there have been, improvements as a result of your work. I think what I'll do is come back to you with the final question about best practices, because Jamie's back with us and hopefully we'll be able to keep the connection. So, Jamie, I think what we need to do is, can you turn your camera off and then hopefully we can keep your audio? And you should still be there. Can you hear me, Jamie? Okay. I don't think he's been able to keep the connection. I'll come back to you, Geoff, and just ask you the final question before we look at some questions from the viewers. So, what best practice tips have you got about campaigning on mental health issues in the workplace? What are your recommendations to viewers?
My recommendation is the fact that just because mental health isn't visible to everybody, it's still there. And just because you can't see it doesn't mean that somebody hasn't got mental health. Everybody suffers from mental health in one way or aspect or another. I'm sure everybody that's participating in this webinar would say it's about reaching out. It's about reaching out to the individuals. It's about learning about individual struggles, and it's about seeing how best you can help that individual, especially when it's crisis, when you've got nowhere to turn to. And it must be horrendous to think that the only way to do that is to do something severely bad to yourself. But there's a cry for help, and that cry for help needs to be listened to. So talk to people, educate people, make sure you share, and this is all about sharing. Share your stories, share your views, share your support networks, and use the TUC as well, because obviously they've got some real good training packages, especially around mental health. But also there's some services out there which will bolt onto your trade unions and will support and help your trade unions. counselling is a big thing.
There's some great advice there, Geoff. So we'll take a breath for a minute. I know lots of you wanted to hear from Jamie, as did I, because he's done some great work in his workplace as a CWU rep to help tackle mental health issues at work and improve things for members. But what we're going to do is invite him back to a future webinar because I don't think we're going to be able to get him back today because of various technical issues, which is a real shame, but we will get him back, I promise, for the future. So I'm going to look at some of the questions that we've had from our audience and see if you, Geoff and Stephanie, can offer any advice to them. So one of them, we started to answer this, Stephanie, where you talked about reaching out to other organisations, other third-party organisations that might be in your geographical area. So one viewer has asked if they think union reps should reach out to local mental health trusts. Is their training helpful? So, for example, with their employer, they have connections with the Greater Manchester Mental Health Trust. Have you got anything you can add to this, please?
So, from through USDAW, we've got some amazing speakers as well that come and speak about mental health and things like that too. I know that we've got local people through trusts that come into the call centre when we're running campaigns and things like that, and that do come in and speak a bit about on mental health. They also are available for questions. So yeah, definitely reach out to your trust, ask them, do you mind if you come in and have a day in my workplace with me and let people ask questions? Definitely. Guests are always it's always good to have a wee guest, like we're guests here on this panel today. It's always good to have a guest on a campaign, and someone who has a little bit more knowledge. Definitely.
Thanks, Stephanie. Have you got anything to add to that, Geoff, about working with third parties or other organisations?
No, I totally understand where Stephanie's coming from, and obviously working with other organisations helps get that message out there. It's a little bit different when you work with the restrictions that we've got within prisons, reaching out for that, and it is quite hard to do that. But it's not. It's something that can be done, and we do. We've got our own counselling services within the POA ourselves, our online counselling services, and we do attend quite a lot of the events to try and make sure that we reach out to trade unions and any kind of services that are out there. And we have an annual conference as well, and we try and invite people there to, very much like what Stephanie said about speaking, but also we have stalls, educational criteria, and that's what wellbeing days as well is a big thing. We have quite a lot of wellbeing days within establishments now, within prisons, and we take different people in there as well. So it is all about support network. It's all about educating people, and fundamentally, it's all about talking, and it's something we just don't do.
Yeah, I think you've got there's a real point there about talking about things is the first step, and that leads me on to the next question, which is about self-awareness of mental health. I think, Geoff, you mentioned a few minutes ago that that's one of the like substantial issues that you deal with is helping someone become aware of their own situation. So have you both got some advice about how we can lower the stigma of mental health issues so the workers and colleagues are more likely to come forward? Let's go back to you first, Stephanie, because
So yeah, like Jeff says as well, in my workplace we have a lot of wellbeing days too. We've also got wellbeing first aiders within our workplace as well. So I think awareness, I would say, just ask yourself, are you okay? If there's any doubt in your mind that no, I'm not okay, seek help, seek advice, go to your GP. I've found myself going to the bathroom and opening the bathroom door and thinking I've seen someone put it in the comments, a big poster about "Are you okay? How's your mental health today?" Things like that just sometimes trigger somebody to say, Actually, am I okay?" But I think the main important thing is just to make sure that well-being make sure you maybe go for a walk if you can, or you're sometimes a lot of that's drinking plenty of water, making sure you're eating the right things. It doesn't stop mental health, but it does maybe put yourself in a wee bit of a better place. I know myself, if I'm having a bit of a bad day, I get up, I maybe go for a walk a wee bit, and then I come back and I could get on with my day. But I definitely do think the question is to ask yourself, and if you ask yourself many times and you always kind of get the same reply, no, I'm not feeling okay today. It's okay not to feel okay, but just make sure you're speaking about it and you get the help that you need to get you through these days. That's not okay.
Thanks, Stephanie, and welcome, Jamie. I'll come to you in a second. I can see you're on a different device now, so fingers crossed. Geoff, just anything to add about the lowering the stigma of having mental health issues so that people feel more able to come forward?
Yeah, and I think the publicity as well. Publicity needs to be around the fact that just because you might have mental health, it doesn't stop you from working. It doesn't stop you from going around the whole of your day. It's about really having that way, very much like Stephanie said, coping mechanisms. But if we are going to take it serious, we need to be done on a different platform. This needs to be done politically as well. You know, why haven't we got basic mandatory training of mental health in schools? Why haven't we got that? You know, it's serious, but also our young people are our future. So why are we not investing in that? Why are we not looking at more and more TV programs, more and more talking about mental health? Why are we not publicising it to such a degree? Stop playing about it, and actually do something about it. If it's that important, as it is important, we need to be standing on the highest hill, shouting it out, telling people this is what you need and this is how you can get over it.
Thanks for that, Geoff. Right, Jamie, are you there? Can you hear me?
Yeah, I can hear you. Sorry.
Great stuff. That's amazing that you're back, and I've both hands, fingers crossed that we keep the connection. Okay, okay, nice and clear. Right. Everyone wants to hear about what happened in your workplace, and I think you started to tell us, but then we lost you. Just tell us a little bit about what was happening in your workplace and the action that you took on mental health.
Yeah, I mean, obviously, I mentioned the pandemic. I don't know if people heard that, and that was a massive issue for us.
Yeah,
but then
that's when we lost you.
Oh, right. Okay. So our policy in the union after that came about, where we tried to bring mental health first training in-house, so that it meant the CW instructors would be delivering CW mental health first aid training to our members. So our strategy has been to do that. We've trained over 500 people in mental health first aid. Most recently, a lot of these people have become advanced mental health first aiders. But for us, I mean, I know there's a wider debate on mental health first aid, but these people have been invaluable because the conversations that are happening in workplaces, and some of them are informal conversations and some of them are formal. So informal conversations take place regularly. We also encourage people to have formal conversations, i.e. stress risk assessments, which sound complicated, by the way, stress risk assessments, but they're not at all complicated. And now our network has grown. Obviously, 500 people trained. We have networks, big network in the Northwest. We have networks in North Wales, the Midlands, in Eastern region, and we try and share best practice examples, information, and risk assessment templates, you know, to help colleagues support people in need. And, you know, our key message is anyone can start and develop a mental health support network.
Thanks, Jamie. That's really interesting. I want to ask you a bit more about stress risk assessments. So
Yeah.
We all know that risk assessments aren't the responsibility of the rep, they're the responsibility of the employer. But
Yeah.
what the workplaces that you've been involved with, what was the rep's role in a stress risk assessment? How were they involved?
Well, don't forget, with stress risk assessments now, people who are mental health first aid trained on the 2-day course, they're actually deemed competent to do stress risk assessments. So we will always make sure the employer knows its obligations, but if we are best fit as a trade union to undertake those stress risk assessments and present them to the employer, we could do that. We have lots of trade union reps who are doing stress risk assessments and then presenting recommendations and a stress action plan. The employer to say, look, you know, this needs to be acted on. I mean, I always believe in risk assessments because I think we see a lot of people who will assume risk and not actually assess risk. And assessing risk for us is massively important because most of the people who are receiving risk assessments, either a stress risk assessment or a disability risk assessment, feel better for it. They leave the room feeling better when they've got a formal agreement in the back pocket. So, you know, yes, it is an employer obligation, but sometimes our subject matter experts are in a better position to undertake them stress risk assessments.
Thanks, Jamie. So for someone who's not been involved in a stress risk assessment, can you give us a couple of examples of the sort of questions that might be asked as part of that risk assessment? If you've only ever done like a physical risk assessment, what are the differences?
Yeah, so the standard stress risk assessments in most workplaces is built off the HSE standard, which is the talking toolkit. So the talking toolkit is accessible for everyone. It's a HSE standard, and every single stress risk assessment will identify the 6 key stresses in the workplaces. There'll be a series of questions, and it's totally holistic. It's person-centered. With a stress risk assessment, you've got someone giving you the answers that you need. It's not like a fire risk assessment or a yard risk assessment. You're going in to a room where someone can give you information to help best support them. But I'd urge people to have a look at the talking toolkit. You know, in fairness to the HSE, it's a really good tool to use. I mean, as I say, employees have different interpretations of the talking toolkit, but the standard is the same. It has 6 key stresses that will be discussed, and on the back of it will always come a stress action plan. The person will leave the room with a stress action plan and with formal agreements in place. So, you know, that's really why we do like it. And, you know, we'd urge people to try and undertake them if they can, because, you know, you'll be surprised the benefit it brings to people.
Thanks, Jamie. And we will post a link to this tool that you're talking about so that people can take a look for themselves and see the examples that you've mentioned. Okay, I want to get back to a couple of the other questions that have been posted by the audience. So we've had quite a few questions on this next subject, so I'm going to combine them all. People feel that sometimes there's a bit of a danger of an employer perhaps ticking the boxes, having a well-being day, or having a it could almost be for show, is the suggestion. How can we get the balance right between them really taking workplace stress seriously and acting on it versus the perhaps performative nature? We'll come back to you in a minute, Jamie. Let's see what Geoff and Stephanie have got to say. Geoff, let's go with you first.
All right, can you repeat the question, please? I think I've got a bit of a signal problem.
Oh, sorry, I was muted there. No worries. How can we get the balance right between an employer really taking stress and mental health in the workplace seriously, and then perhaps doing the right things on the surface, which might be having a well-being day or having the kind of sort of maybe easier things rather than tackling the issues that are causing the stress initially?
I think when you look at the employer, it's very difficult for us because obviously when you look at our environment is a closed environment, especially within the walls of a prison, but also governed by HMPPS. So obviously Justice Minister and obviously Prisons Minister control obviously the narrative of that. So it's really difficult, really, because there's restrictions. Governors, senior managers will only ever be told one way to complete something and have the protections of government legal departments behind them. But the easiest way is to probably get rid of somebody before tackling the problem. And the problem of mental health within the prisons is just one aspect of it, but mental health is a big problem anyway. So I don't think until we start tackling it through policies, until we start tackling it through risk assessments, until we start tackling it through employment tribunals and things where wrongful dismissal and stuff like that. I don't really think we'll get anywhere within the prison service with it. I think it, as we call Civic Street, is a little bit different to what it is inside a prison.
Thanks, Geoff. Stephanie, what about in your workplace, which obviously is quite different from a prison? How can we get the balance right between employers taking it seriously and perhaps doing something that's easier?
Don't give up. I would always say to my union, always fight for what's right for our members. And that's what I would always say. I always say work in partnership. I would love to, I always go to, for mental health and things like that, I would always go to the management and work in partnership and make them aware of actually, this is what we could be doing differently. This is what we could be doing maybe a bit better. I would always say, don't ever give up. If there's always still an issue, just keep at them, just keep going at them, and just keep saying this is a workplace issue. Risk assessments, I've never seen one being done, but I do hear them being spoken about a lot. The more risk assessments, the more the business will start to see, okay, there's maybe a bit of an issue here. I would always say to make sure that you're following policies, making sure that you're feeding it back to the right team. But I would definitely say don't ever give up and don't sit back on it. Fight for your members to make sure that actually it isn't a policy somewhere or it is done correctly.
Thanks, Stephanie. And we, of course, would say this about most issues. They are, you can bring them to the negotiating table, get a policy in place, because then kind of everything's laid out, policies can be reviewed, they can be improved upon, and everyone knows where they stand. Jamie, let's come back to you. Have you got any experience of this in the workplaces you've been involved in?
Yeah, certainly with awareness days. I mean, one of our big challenges is to challenge employees, who claim to be disability confident. So we say, you should be actively trying to prove you with disability confidence. So in our area, for example, as a trade union, we've done over 350 stress risk assessments in the Northwest region, in the last sort of 5 years, and we will then compare that with our employers where we have representation, show me, are you disability confident? How many people are covered under the Equality Act? With work and adjustments for a mental health disability, are they taking it seriously? Because for me, I don't like employers who self-badge themselves as disability confident. I think you've got to prove it, especially when it comes to mental health disability. So awareness campaigns are good, to be honest with you. We always try and support 4 a year. We always do Time to Talk Day in February, World Mental Health Week in May, World Suicide Prevention Day in September, and obviously today, World Mental Health Day, to try and keep mental health on the agenda. But we've got to lead as trade unions and not follow. We've got to set examples. We've got to innovate. We should be better than employers as trade unions. We've got to lead and not follow. And if you do that and you take that challenge on, then you'll find yourself undertaking more risk assessments, more support, putting in disability passports, workplace adjustment agreements. And I think Geoff said, be prepared to go to tribunal, because we will do that on many occasions if we feel like a vulnerable person is not being supported properly.
Thanks, Geoff. And oh, sorry, you just switched places. Thanks, Jamie. That leads me on to my next question, which is about adjustments. You mentioned about getting adjustments. What experience or examples have you got of where adjustments have been made for colleagues around mental health? We will also, we'll post a link to the TUC's resources that we've got about reasonable adjustments and reasonable adjustments passports, which is as an initiative we published information about a couple of years ago. But have you got any examples of changes you've made for members on this? Jamie?
Yeah, so yeah, we have got loads of changes, especially, and when it comes to mental health disability, in our experience, 90% of the reasonable adjustments are cost-free. It could be something as simple as regular routine. It could be something as simple as measuring the effects, the side effects of medicine. Does that person need to start a bit later when the medication may be kicking in for them? Think workplace buddies, workplace chaperones. Do they need to work with support? Quiet rooms in workplaces. There's so many examples of reasonable adjustments. But I say, with mental health disability, I'm talking from experience now, over 200 mental health disability risk assessments, 90% of them are cost-free. And we have to say to the employer, there's mutual benefit. You can have someone in work, and the reasonable adjustments is in 9 times out of 10 doesn't cost you anything, you know. But one thing I will say when we do this is even the most minor adjustments can make a fantastic difference to someone. It really can. And from my experience, people with mental health disability make fantastic employees when they're supported, you know. So don't just, you know, again, as trade unions, wait for a disability declaration. Challenge the businesses and say, we believe our colleague is disabled. Do you agree with us? So, you know, approach the business and with a formal disability declaration from yourselves on behalf of the people you're supporting, because you'd be amazed that the minor little adjustments do make massive differences for people.
Thanks for that, Jamie. Stephanie, you were nodding a lot while Jamie was
Yeah.
speaking there. What did you want to add?
Yeah, I totally agree. It could be something as little as a different time to start it. It could also be something, oh, maybe they need to sit closer to the door. It could be something maybe they've got to have the radio on, and it's just trying to get that balance, because it's people like having the radio on, but then also people don't like having radios on when they're working and things like that. So it's just having the balance that's right for people. But I definitely do agree with everything Jamie said. Always ask your employer. Your employer will always give you the advice. Ask your employer, ask us as reps, ask us as unions. We'll always give the correct advice of actually what we can do to support you in your workplace to get you to work, and any adjustments that would be good for you to have in your workplace. We'll always have something.
Thanks, Stephanie. I've got another question now that I want to put to the three of you. In the work that you've done campaigning on mental health, have you found that are employers helpful or forthcoming in giving you information and statistics that help you make a case? If not, how have you managed to get this information from them? Perhaps about sickness absence or other information that would help you on this campaign. Let's come to you first, Geoff.
Yeah, thanks for that. We have quite a restriction in gathering information, as you can understand. Any kind of release of information, especially when it comes to the Ministry of Justice, is really quite hard to obtain. But there is ways of obtaining subject access requests, health and safety minutes. We obviously use our health and safety reps. We obviously use our branch officials, and we obtain quite a lot through collective meetings. So we'll have collective meetings where information's there, and it's all about sharing that information to obtain it. But we do have a real struggle when it comes to reasonable adjustments, especially within the prison service, due to the fact that frontline staff, basically, the slant from the employer is, if you can't do your duties as a frontline officer, obviously you can't take a prisoner home, you can't have a reasonable adjustment elsewhere, because that's fundamentally your role. So there is a massive push from the employer to look at retiring people, medically efficiency people. So it's a struggle for us and obviously our reps as well to prevent this. So obviously 2-year pay protection and stuff, otherwise we look under the Disability Act and Equalities Act. So there's quite a lot of things we use to combat the lack of them wanting to give us information and the unjust and discriminative views and ways of the service. You might think it's all rosy for HMPPS, but let me tell you, working for the government is really quite hard.
I'm sure it is. So Jamie, have you been able to get information from from the workplace, from the business to help you with the campaign?
Yeah, I mean, obviously, as Geoff mentioned, we have situations where everything's governed by privacy and confidentiality, but we do get details on the levels of stress-related absence, and we try and compare it with like what's going on nationally. So, yeah, I think the HSC have said each average stress absence is around 20 days. So we talk to the employees, say, look, what can we do to try and buck this trend and get people in earlier? And they've now started to agree with us that stress risk assessments do have mutual benefits. We do it from a purely person perspective, totally holistic, person-centered. But the business get a benefit when these risk assessments are undertaken. What I always do is I challenge the businesses where I represent people to say, okay, if you've got risk assessments there, share them with the trade union, but what the templates of risk assessments are. We don't want people's names on there. We want anonymized risk assessments, but show me what a risk assessment looks like for bipolar. Show me what a risk assessment looks like for PTSD. Show me what a risk assessment looks like for clinical depression, because they should have these templates there. And I'm a great believer that if they're not good enough, trade unions can make them better. So that's why I keep saying we've got to lead and not follow on this. It is difficult because of privacy and confidentiality, but you can get information, protected information, but you can get useful information off the employer.
That's great, Jamie. Thank you. Stephanie, I wanted to put a different question to you, because I know that you are a home worker.
Yes.
And that maybe is a bit different from Jamie and Geoff's experience. So the next question that I'm going to put to all three of you, but I'm going to put to you first because you have an unusual situation. How can you spot signs of stress or other mental health issues in your colleagues, especially maybe in your situation when you're not physically with them? How would you spot that?
So although I work from home, I still get a 5-minute call sometimes in the morning. Everybody jumps on and we're all like, hi, everybody have a nice day. And it could only take for one person that that's bubbly and maybe always having a wee chat in the links, and when we're having a wee chat could maybe just be a bit quieter. So it would just be a matter of pinging them and saying, hi, how are you today? Are you okay? And sometimes that's all it needs to be is, are you okay? So that's where I would pick up on. Sometimes I get people just to reach out to me themselves that'll just reach out and say, I'm not feeling good today. Can I have 5 minutes with you? That's not a problem. Come on, let's have a wee chat. But I would notice, probably with me being a home worker, the way that people maybe type. Some people could take typing totally different. So if I was to type something to you, you might read it different to the way I would read it. But I would say that I would notice in the way that they were having conversations, or they were holding conversations in the chat, or maybe not replying back to people saying, how are you today? Things like that I would notice and I would pick on. I wouldn't say in the chat, oh, are you okay? I would message them privately and be like, hey, how are you? Are you okay today? And I would ask that question privately.
Thanks, Stephanie. And Geoff, you in your workplaces there's no home working for obvious reasons, but how do you and how do POA reps spot signs of stress or mental health issues in colleagues?
I mean, I think you can understand the environment you work in. You work really quite closely with individuals, and being part of a prison officer is identifying different aspects of changing of behaviour, patterns of a behaviour, and also very observant when it comes to things. Very much like what Stephanie was saying as well. You'd notice aspects of people's working behaviour would change. You would see emotions. You would see people not eating, people drinking, and worrying, concerning little signs that you pick up, especially if you work with that individual day in and day out.
Thanks, Geoff. Okay, I want to try and get through another couple of questions before we wrap up. A couple of people have suggested that while an employer might be approachable, might be very good in this area, that individual line managers can maybe not necessarily be helpful, and that they might add to pressure and stress that an individual is under. How can we deal with this issue, even if the top level is great, but maybe the managers immediately aren't? Jamie?
Yeah, I think in this issue, we make sure duty of care responsibility shifts to another manager, and that's a formal request, and that's done in a way whereby under duty of care laws and obligations, we make sure the person who is supporting the individual, needs to be recognise that they may impact on that person's stress. So anytime someone's having a conversation with a manager or a stress risk assessment, they're not going to open up if the person in front of me is maybe the person causing the stress. So we always say, if someone identifies to us that a particular manager or a colleague has caused them stress, we then request a duty of care responsibility shift. So that responsibility goes up to the next line manager, so that that person is taken out of the room, and then the conversation can open up freely. Never be afraid to ask for that, because your aim of supporting people is start a conversation and support them based on what they tell you. So if you need that duty of care responsibility to shift, request it, because they will do it.
That's really interesting, Jamie. That may be something that not a lot of the audience knew you could do. So I think that that's really helpful. Stephanie, what about in your workplace? Have you got situations where the employer might be helpful, but the individual, like middle management, I guess, isn't?
Yeah, so yeah, I would just go to a different manager, or maybe if they're not helpful, I would try and work with them to find out what the barrier was, how we could overcome that barrier. So we would work with them to say, okay, if I wouldn't go out and say I don't find you helpful. I would maybe just say, okay, what's the barrier? What's the barrier we're getting? Why can't we do this? What's the reason for it? And then if that was the issue, I would go to my other manager, or I would probably go to my area organiser and say, look, I'm having a wee bit of an issue here. Within the union, I would say I'm having a wee bit of an issue here with one of my managers. Are you able to come in and see if you could sit with us and see what else we can do? Sometimes just getting a union rep in with you as well to have that conversation with that manager could sometimes just maybe make them move along a wee bit, or be a wee bit more helpful. But I would always try and find out what the barrier is and work with them. I don't like to think that I can't work with anybody or anything like that. So I'm one of the people that just say, no, I'll let's try and go over this barrier. Let's try and see what the problem is. But if there is a problem like that, I would then just approach another manager and ask them to give me help and advice.
Thanks, Stephanie. What about you, Geoff? Do you find this issue that the prison surface at the top level is helpful and then in the middle not, or the other way round? And how do you overcome it?
No, I definitely find it the way you're saying. The cascading from top to the bottom is obviously diluted. And obviously what you normally find is highlighting the failings of that individual manager that's obviously maybe's not got the training, the lack of knowledge. But, you know, I would quite easily use the occupational referral, the stress risk assessment, disability passport. All them mechanisms are there to help individuals and signpost individuals around any kind of obstacle. And they can be used in conjunction or they can be used separately. But and then obviously the grievance processes, the ACAS, lowest means of ACAS guidance. So there's lots of things you can use. We have a thing called forms, which is formal attendance review meetings, very much like I think what Jamie alluded to. So there's aspects there where you could quite easily have that person removed, or you could leapfrog that person to make sure that the individual that you was representing had the adequate support they required.
Thanks for that, Geoff. And I think we've really kind of had some really helpful advice here, helpful examples, and hopefully lots of tips and best practice that you, the audience, can take away back to your own workplaces. I was very aware before we started this webinar that we have 3 different unions and 3 quite different workplaces, the prison service, call centre, and Jamie from the CWU. These are all very different. But what I think has come out is that there are commonalities and shared experiences that you can apply in your workplace, be it healthcare or education or transport. That the situations might be different, but the experiences can be shared, and we can all work together in similar ways to provide support to members. So thank you very much for joining us today, and thank you for bearing with the technical hiccups we had earlier. Especially Jamie, your persistence in keep joining us, really grateful for that. And hopefully some of you in the audience will be coming to Union Reps Connect, which is on Tuesday the 15th of October, so next Tuesday. It's in Congress House at the TUC's offices, and I look forward to meeting many of you there. Do come and say hello. I love meeting you and hearing about what you've been doing in your workplace. Tune in again in a few weeks for another webinar, but it's bye for now.